She's coming in because she's been experiencing some restrictions and some pain, some discomfort in her hips and everything. She's been weightlifting, so just over here at Rejuvenation, trying to rejuvenate her body. She'll let you know a little more what's going on.
So I have a little bit of tightness in my hips, and I feel like my hamstrings get pretty tight when I lift, and also I experience a little bit of tightness in my traps. So it just feels like it's hard in there a little bit.
Sounds good. Yeah. So I mean, typical. Everybody goes through this. I've seen a lot of people, experience these type of difficulties as they're weightlifting after trying to recover. So I'm just gonna assist her in the recovery, try to release some things and make sure that she's good for the next time she lifts and she's hitting some PRs. All right, so we're gonna start with the low back, and we're gonna really target the areas that can affect her range of motion for her hip. Now, this is a very complicated area, the hip / thigh. When you get into the posterior, medial, and lateral aspects of all these muscles, they can really affect the way you sit, run, walk, really any activity that you do slightly. So we want to take care of these for her so that she is really on a level to expand her weightlifting and be flexible while doing it and comfortable. So yeah, we're just going to target the gluteus maximus, the medius, the minimus, and really target all the hip flexor muscles, getting into, her psoas major, minor, really getting into the iliacus, targeting her piriformis, and, we're going to do stretches along this session today with Rachel, but I'm just glad that she was patient with me because these do take good patience and a good feel for a release. And sometimes people are really tender in these areas. So I'm just glad it's not me, but she can definitely feel the difference as I just put just a bit of pressure on a couple points in her hips. So definitely want to be patient and work through these things for great results and consistent, effective results. Now, I really want to dig in and get into all the attachment sites, kind of wake the muscle up a little bit and let it know that I'm here, but I'm not here to hurt it. So, again, taking your time is key. Little motions as I'm doing help me get through different muscles. Sometimes it'll help calm down muscles, or I could break down certain areas that have adhesions, and even sometimes trigger points pop up as I do these motions. So we just want to get as much releases as possible with the least amount of pain, but unfortunately we can't shy away from any discomfort because that's just our nervous system reacting. So more motions, not really doing anything out of the ordinary, just getting through layers. And as I'm resting my hand on her hamstrings, I'm still feeling for a reaction. Any jump in any type of muscle area or muscle group in that area. I want to loosen up her TFL, her vastus lateralis, target her rectus femoris. Her sartorius is probably tight as well. There is a lot of gluteal fascia that can be broken down. I'm sure there's a lot of tension along her iliotibial tract, and we want to also create her adductor magnus, or assist her adductor magnus to be a little bit more flexible. Her gracilis is tied in with that as well, but there's multiple muscles that can be manipulated here to help the regeneration and the rejuvenation of this muscle so that she can perform at a higher level. I'm really just trying to move things around, create a lot of movement. Breathing is very key as I ask her to do this throughout the session. These are very key aspects of a massage, is if you're breathing or not. Are you communicating with your therapist? We need to hear that. This is not just a one-player game. This is two people, and the body is very complex. And we want to do the same thing to the other side. We want to keep her even. We don't want to have things out of whack. So I'll target the same muscles on the other side. This side she has no problem with, but we still want to help promote blood circulation and also loosen up any things that are hiding that she doesn't notice yet. So we'll get into there for a little bit and continue releasing and rejuvenating Rachel. A lot of the rocking I feel is very good for a good relaxation, a good homeostasis. It helps things go into place, and it helps me realize and notice things that are out of place. On the devil, on the devil, on the devil. On the devil, on the devil, on the devil. All right, so we'll start with her upper back as well too. That's something that also plays a key part in some of the muscles that we worked on in the lower body, in the low back, and in the hip and thigh area. So again, the rectus spinae group is also one of the superficial layers up here in the upper back, and that can cause problems throughout the length of the back. She certainly has a lot of adhesions. I already know there's trigger points throughout that need to be released, and so I just want to warm up her upper back with a little bit of Swedish massage, but also um, some myofascial work. I want to move the scapula around, make it mobile, um, create a lot of separation from the spine, and bring space in between that spine and scapula. I want to break down any type of muscles underneath that rectus spinae group. The levator scap definitely plays a big part in some of her shoulder pain. I know her traps, her upper traps, and her mid traps are really bugging her. Her rhomboids. If you get into her neck muscles too, there's the semispinalis capitis, splenius capitis, and the splenius cervicis. I mean, those things can really promote a lot of relaxation if you're doing some type of Swedish massage, or if you are actually releasing some areas in those muscles. But we want to get as deep as the multifidi or fidi. Don't know how to pronounce it, but definitely know where it is and where it's located, and what relief it can bring when it is targeted and worked on. Um, and also on her ribs, you want to get as deep as her ribs. You want to help her breathing. You want to help her breathe better. Feel like everything has opened up for her, and her rotators. Her rotators really assist within everything. All three of those muscles can assist in a better, comfortable back, upper back. It'll help your posture if those things are worked on correctly, with patience and with meaning. Um, as I'm doing now, I'm just trying to create that range of motion in her shoulder blade. She says she felt some tightness in her front shoulder. So I'm relieving some of that pressure off her front shoulder by accessing deep muscles in her scapula, or underneath her scapula. Like I said, I'm really trying to target deep muscles with as little pain. Again, breathing is key. And like I said, we want to do this to both sides, break down any adhesions, find any trigger points, and release. I do move her limbs for some active release techniques, and I also apply some mat techniques as well. And we want to optimize the neuromuscular therapy as well, for a total, complete, customized therapy from rejuvenations. All right. Again, pull up the scapula, stretch it out. We want to create space. Oh, slipped a little bit, but and get even deeper. Remember, deep muscles will create a lot of releases if triggered right. All right. More myofascial. Make sure things are nice and stretched out. We want to get her lats. We want to get every type of muscle that can assist in loosening up and bringing space in her upper back, upper traps. We want to relax them.
Blood circulation is great, as you guys can see. It's right on schedule. We want to see if there's any tightness. Compressions. We want to get to the mid back, low trap area. All right. The internal oblique and the external oblique can be really worked on here. The thoracolumbar aponeurosis, again, more of the erector spinae group, all superficial layers. And again, the multifidi transverse process. We want to focus on all of those things. I will also be moving her leg as I have my hand on one of these points just to help assist in a movement to get me past a layer to release. Patience is key. Just remember that in breathing. Just keep reminding. Again, rocking with a good amount of pressure. Using circular motion for some great releases. All right, so I'm gonna start moving her leg now. And just like this, I'm opening up areas, I'm hitting areas, and then releasing as well. As you can see, a little twitch there, wasn't ready, but definitely fell back on it again, and it will release. All of it is connected. We want to use movements, active movements, just to help with areas that can be affected or have limited range of motion. It's not necessarily just localized in one area, it could be throughout the body. Let's not forget that everything's connected. Yeah. All right, so now we want to relax the muscle, a little bit of Swedish myofascial work in her low back, her QL. We want to bring blood to all of that, relax her a bit. She's been through a little bit. So we want to just relax the body, relax all the tissues, just warm up all the tissues, her sacrum, any type of tissue or buildup that is in the low back pelvis area, in the hip. Again, we do want to make sure she's relaxed, but also feels like she's been worked on effectively to help her performance later on. A lot of built up junk. But, I always advise my clients to drink plenty of water to help cleanse. Again, want to relieve any type of tension in her sacrum. There's a lot of attachments around that area. Her tailbone, her coccyx, has a lot to play with this. Her internal muscles within her pelvis are tight as well. So we just want to get certain movements to help with flexibility. Again, range of motion in her hip, in her pelvis. So nothing's backed up or nothing's restricted. We want to make sure everything is firing at once, and so that she can actually hit better personal records and just improve overall in her lifestyle. The way she feels, the way she wakes up when the day's about to get started. If there's any soreness or any pain that holds her back from any type of activities, we want our people to be comfortable wherever they are, whatever they're doing, no matter how old or if they've had past injuries before. We want people to feel like they can get back to 100%, inspire, and create positive lifestyle environments. Um, Now here I'm just doing some mat techniques for her groin, her internal muscles, any ligaments that need strengthening, stretching. There are deep muscles. Um, the gemella superior, the inferior, the obturatus, internal and externus, the levator ani, any type of muscles that are in there are being affected, and we want them to start firing at once. All right, so just want to start with some stretches, some muscle strengthening techniques, some mat. Um, really warmed up the muscles earlier. So we brought some blood flow to her ligaments around the areas that we worked on. We want to make sure she has good range of motion and flexibility, and endurance in her ligaments. Her iliolumbar ligament, her anterior sacroiliac ligament, her sacrospinous ligament, her sacrotuberous ligament, inguinal ligament. We want to make sure her iliofemoral ligament and ischiofemoral ligament really have great range of motion, flexibility, endurance. We want to make sure that those things are healthy, and any muscles that helped bring any blood to those areas really helped out with her flexibility at the end of this. So just testing her strength and stretching her out, seeing if anything is not firing correctly. We just want everything to fire at once. That's our goal, and also to have her range of motion back, and also her performance and her endurance during her next workouts, and how they progress and better themselves. Got some great movement within the muscles. A lot of space has been created. Blood flow has been circulated throughout areas of the body. She's gonna be feeling good. I do expect her to have some soreness within the first 2 days, but nothing extreme. But overall, right after today, right after this session, she should already see improved range of motion and no holdbacks at all. So yeah, great releases. I have more content coming soon. Just hit the like, subscribe, comment. Anything you need me to change up or you guys want to see, just let me know in the comments. yeah, I'm definitely going to be having a lot of videos drop soon. Just be on the lookout for that. I appreciate you guys' feedback. Just let me know if anything. I have new office in Tysons, Virginia. 1775 We Work. Come see me there. And remember, health is wealth. Strive for greatness, rejuvenations. We're here for you. We got your back. Reach out if anything. Hit that like, hit that subscribe. I appreciate you. Thanks for watching.
You're gonna try to. Yeah, that's gonna flatten it out.
Way better.